IVM.
Hi everybody, just wanted to ask everyone for a quick favor. We're running a brand survey right now and would really appreciate it if you could let us know what you think about the advertising on IVM. Go to ivmpodcast.com/survey and do let us know. As part of this, we'll be selecting 10 random participants and sending them some IVM swag, so do fill out those surveys.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like to bring fresh perspectives to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hi everyone, and welcome to this episode of All Things Policy. I'm your host Shambhavi, and joining me today is my colleague Ruturaj. Ruturaj and I are both part of the Health and Life Sciences stream at Takshashila, and we are going to talk about some exciting new research that we have done today. Very recently, it was announced that the Centers for Disease Control in the US will launch a new outbreak analysis and forecast center to pick up a group of which is basically going to be led by a group of academic and private sector individuals to look and predict, model, and basically preempt further new outbreaks. This is not just going to be COVID related, but goes beyond this new pathogen that has changed the way we have looked at epidemic outbreaks across the world. Today, we're going to be discussing about whether India needs such an agency for itself, and if yes, how would this agency look and function? We have just put out a document which we will link to in the description here for your perusal and your comments. This document is meant to be a discussion document, so we invite as many comments as possible. We'd love to hear your perspectives on whether India needs such an agency and how it will work. We also would like to invite you to have a look at Taksashila's GCPP program and courses. We offer these in a flavor of 4. There's Advanced Public Policy, Defense and Foreign Affairs, Health and Life Sciences, and Technology policy. The deadline for application for our courses is the 20th of August. So please have a look at them and do apply. Now, coming back to our core topic of looking at this potential Indian National Epidemic Intelligence Agency. Before we get to that, let's discuss about what are some of the technologies that are being utilized to be able to study outbreaks, especially for emerging pathogens. Ruturaj, do you want to take us through a few of these technologies?
Yes, Shambhavi. So when we think of technologies to monitor health-related events, the most simplest thing is to get access to hospital records, be it private hospital or be it government hospital. Each hospital maintains its records, and these records over a time can give us a very clear picture of certain diseases which might be endemic to a region or certain health risks that a population might be facing. But this data is not real time as such. It might have many biases. If a region hospitals are overwhelmed or are underfunded, the record keeping might not be that accurate. So, though this is the most simple and accessible sort of way of getting medical data, we need certain other instruments to get access to such kind of data. And in the last 10-15 years, what has gained importance is trying to gather data from various sources and not rely on just the formal records that a government or a hospital puts out. What I am alluding to is the digital monitoring of health related events, or even like not even just health, but any event related to biological incidences. These might be accidents or certain accidents happening, or certain cases of even intentional release of a biological agent. And these sort of digital monitoring services are mostly employed by quasi-governmental agencies, but there are also certain private entities which are doing this. Now, what goes behind these digital monitoring services is that they scan news from various languages 24/7 all over the world. They also tap into formal records sent out by hospitals and governments and social media, and try to get a almost real time picture of any health related event, and that might lead to and such an event that might lead to certain chatter in the world, in the digital space. So this is increasingly becoming the level of first level, and that then feeds into much more formal and analytical levels.
Right, and we saw this, I think, for COVID-19 as well, and particularly because there was suppression of maybe official disease burden, but we saw doctors kind of trying to raise the alarm. We saw patients trying to talk about this on social media, and I guess monitoring those can also provide avenues for picking up potential health threats.
That's right. And having said that, we are not suggesting that this is the way of monitoring, and the data that comes out of this first layer can be trusted or should be directly used. What we are trying to come at it, that this is a very good mechanism to cast a wide net and try to see if there are differences between what the official records are saying, or the official numbers are, versus what people are seeing at the individual or social media level. So these kind of data will also be in different languages and in different formats. So the next level of managing this data or making sense of this data is actually putting them through certain auto translation tools, which also have certain algorithms which do sentiment analysis to make sense. So with what these algorithms do is they try to make a sense of a particular tweet or a certain series of news articles to see whether it's positive or neutral or negative in tone without actual human intervention, and try to give a bigger picture. So the first layer is just gathering all this information. The second is trying to make sense of it, still with minimum human intervention at the digital level. And then this actually feeding into people who are trained to trained to make sense of such data and also have access to other kinds of data. And this other kind of data can be the actual capacity of a nation to handle a pandemic, the vaccination status of neighboring countries, or what is the global scenario. And because this data in a silo won't make sense till you have the global larger picture at hand.
Right. So you're saying that we should have kind of an index of countries with respect to their medical capacities, capacities for testing, the public health systems, and how robust they are, maybe vaccination status, and how amenable they are for a quick vaccination drive, etc. And then benchmark those. And if there is a new incident that we see is happening in one of those countries, we could use that sort of index to kind of calibrate the threat that we might perceive in India or to public or to global public health.
Exactly. And this is not a unique idea. WHO and certain other nations do have certain systems, but there are certain problems because, as we saw in the last year, or the last 2 years, so, multinational organizations like the WHO rely on access given to them by a host country. We are alluding to China. So what happens is that because of certain geopolitical relations, the data might not be as forthcoming as one other country might need. So, like in India's case, we were relying heavily on such outputs rather from WHO and other agencies. So, what we thought that maybe India should have a parallel mechanism that does the same thing. Maybe it can also feed into other global, far more larger machinery, but we need to have such a framework and such machinery that is geared to addressing India's problems when it comes to health related events. These would include accidental releases, a pandemic which might have which might have natural origins, or even intentional release of a pathogen. This would be alluding to certain events of biowarfare. So we need to be prepared for all such contingencies. we also need to be plugged into the global scenario, but also have like a backup parallel mechanism, and that's what our latest discussion document alludes to.
Right, because irrespective of where the pathogen comes from, and we can spend years trying to figure out the origin, the crucial first step is to figure out that something wrong has happened and stop it as early as possible before it spreads and causes more catastrophe, right? We have previously discussed in another podcast that we will link here about the global agencies that are currently working and why they might not have been very effective in predicting the gravity of COVID 19. We will link that podcast here as well. But this podcast is going to be more on how we could structure an Indian agency, what currently exists and what needs to change. And Ruturaj and I will discuss that after this short break and message from our advertisers.
Hey, it's been another great week on the IVM Podcast Network. We have a new collaboration with Hunts Magazine, and there's a show called Hunts Vani that's come out from that. Treat yourself to Sarita Panti's beautiful ghazal Dar Raha Hai Muskurane Se Koi, voiced by Jashne Kalam artist Shashwata Sharma. On Postcards from Nowhere, discover how two different systems on writing were developed, one in Kashmir and one in Kerala. Kunal and Shivani Rajput talk about fitness, entrepreneurship, sibling rivalry, and share their Raksha Bandhan plans on Agla Station Adulthood. Dr. Rajiv and Manik Deshmukh share the love story behind their 52-year marriage on Marathi Kirkitun. Chuck tells us about 5 lessons he's learned on The Habit Coach with Ashton. Do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any other show for that matter, please do tell a friend. And finally, we'd like to thank our sponsors on the network this week, Ciet, Cred, Bank of Baroda, Quarter, CoinSwitch, Kuber, and Intuit India. Thank you so much for making this possible.
Welcome back to this episode of All Things Policy, where we are discussing the National Indian Epidemic Intelligence Agency. So, Ruturaj, can you talk us about what are the current mechanisms that we have to collect data or even look at media discussions on possible health threats?
Yes. So we have a decent framework, machinery rather. It goes right from district hospitals up to national level. So what and this agency is called the National Center for Disease Control, and it comes under the Ministry of Health and Family Welfare, and it's also and the Directorate General of Health Services is the highest officer, if I can use that term, which is this particular agency. It's called NCDC. Now, what NCDC does is it also trains personnel. These personnel are trained on to assess field data, to make field assessments, as well as to make sense of data coming from different government hospitals, right from district and up. And these then staff go back and then occupy various positions. Along with this, they also run a particular surveillance program. It's called the Integrated Disease Surveillance Program, IDSP. This IDSP is under NCDC. It's one of the programs run by NCDC. And as we alluded to, different layers of getting data. One could be digital, one could be from hospitals, and stuff like that. IDSP also has such elements. It has a media wing. So it scans media reports from all over India to see if there are any health related events that might have not been reflected in official district hospitals, as well as it gets data from district hospitals and up. Currently, 97% of Indian districts have such a reporting mechanism in place. There are certain lacunae in the sense private establishments are not covered. That is, private medical establishments, be they small clinics or hospitals, don't readily update. They do update their records, but this doesn't feed as easily into the IDSP mechanism. And another lacunae in this is that the pathological labs, which do all the testing for government labs, also don't have a, also don't feed seamlessly into the IDSP mechanism. So we do have the first layer in place, but we definitely need to improve on it. One more thing I would like to highlight here is that the data IDSP collects is in the format that can be then run through these algorithms I mentioned in at the beginning of the podcast, which can reduce the human burden and can sort of pass through a lot of data. But what I'm referring to is auto translations and sentiment analysis. But somehow the IDSP data, especially the data that is collected by the media scanning and verification cell, is not run through such algorithms. So definitely we can improve on this front. There are other institutions, government institutions, which don't really monitor or have capacity to deal with epidemic, like outbreak of epidemics or biological events, but they can contribute to some extent. What I'm talking to are certain DRDO laboratories which undertake research in biological warfare and how to counter biological warfare if, let's say, a particular unit is affected, or a particular district or a particular geographical region gets affected by a biological agent. So there is certain research happening in DRDO laboratories. Their research can sort of the manuals that these laboratories can produce can then feed into our SOPs. Also, armed forces have a parallel setup. The medical corps of the armed forces also does certain research and develop protocols related to biowarfare, rather how to defend against biowarfare and what to do if certain regions are hit. So we have mechanisms, but definitely there is a space for improvement.
Right. There's a definite need for strengthening. We see it every year, because even our routine diseases, sometimes the scale of them are not caught accurately. When we have surveys done in parallel, we find that whatever has been reported officially is a figure that is usually very low. We saw this during COVID-19 as well. I think the Zero surveys also showed us that we were probably not catching as many COVID cases as they were. And yeah, this has just become a general trend. So therefore, there's definite need for strengthening, even for routine diseases, and definitely a bigger angle for looking at emerging pathogens. This is actually a two-part problem, right? So there's one part where you are saying that we need to be able to catch the diseases that are coming up, and the other part is that this needs to feed into some sort of public health response. So just having this agency is not sufficient. So this agency clearly has roles in trying to gather data, analyze it, do the benchmarking against an index that we spoke about earlier. If required, maybe even try and get samples to be analyzed. And these don't have to be samples from human beings. These could be samples from, say, wastewater, which is an exciting technique that is being rapidly scaled up. So you can actually pick up the SARS-CoV-2, for example, in wastewater and be able to characterize it. So the idea is that you can try new techniques for preempting a disease, to put in public health measures in place quickly enough so that it doesn't become a super spreader. How do we try and establish that kind of a mechanism where it's just not picking up data, but it is actually leading to public health measures, particularly in India when you have so many different departments that are involved in getting the data, analyzing the data, and then tackling the data. So does it make sense that you have this central agency that can then be made up of people from across departments and therefore increase the crosstalk between those?
Yes, I mean that's one of our proposals in our recent policy document. What we are suggesting is a national level service, a national epidemic intelligence service. This would gather data from digital means. Also, as Shambhavi alluded, there can be personnel who go to fields and collect samples. It could be from humans. It could be from human patients if it's India, if proper permissions are required, or else it could be from environmental sampling. Maybe these people can also operate in neighboring countries or friendly countries where we might need samples from them. So the idea is the first level should get data from all possible sources, digital, physical, as well as formal records. Now, and this should like cover the entire nation, the country of India, as well as maybe neighboring regions as well as other countries that are interest to India to begin with. The second step would be to analyze data, because just this large data is not going to make sense. It might even lead to wrong assumptions if it's not analyzed properly. And so what we are thinking is people at this level, the data analysis level, should not just be trained in public health and medicine, but also should have policy related education and training, as well as certain people who have a strategic mindset and actually trained in strategic studies to make sense of far longer strategic implications of a disease outbreak or even health trends over a while that might lead to certain strategic threats to the country as a whole. And this middle layer, when it analyzes data, then can pass on their inputs and suggestions to maybe existing national agencies. Like it could again be NCDC or even the Ministry of Health, along with even the Ministry of Home or even Defense Ministry, to then make sense of it. So what we are saying is like how the intelligence agencies of India gather information about other things. It could be signal intelligence trying to monitor telephonic communications of other nations, or developments in military movement, developments at developments related to any biological event should also be a regular feature that is then used at the national level when such strategic decisions are made. So that's what our vision is.
Right. And I think we also talk about the fact that this doesn't have to be limited to humans. We have far bigger threats also to our agriculture, to our animal husbandry. And obviously, a lot of those diseases, could just from animals move to humans, and hence it's important that we monitor them. And the destruction of food, either agriculture or animals, is by itself also a big threat to India. And as newer and newer technologies come in, as more and more experiments are being done, we believe that that threat might just increase.
Okay, I wanted to just add a few things. When we say this intelligence monitoring or surveillance agency needs to get data from hospitals, of course, it's without saying that it will be anonymized data. It's not going to be individual patient records, but the overall trends. And one of the lowest hanging fruits is incorporation of medical, like private medical data from private medical establishment into this, because in India, if like many people, even if they cannot afford, employ services of private medical establishments. And to begin with, I mean, this could be the first step as such. There are other long-term things that this agency will need access to, and those are like indices of countries, other countries, and so that so that when this data is looked at the global perspective, we have data at what is called as medical intelligence of other countries as well. Because if you want to expand it to a neighboring region, we need like a foundational data about that as well. So that's what I wanted to add.
Right. Thanks, Ruturaj. I think basically the point is that India needs to build this capacity for its own protection, as well as for then feeding into WHO or any other global health agency, so that we can also contribute to global public health protection. As COVID-19 has shown, this is not any one country's problem. This can quickly become a global problem, and therefore the only way out is global cooperation. But India could become a leading sort of light on how we can better be able to preempt such outbreaks. So thanks, Ruturaj, and thanks everybody for listening. Do stay plugged in for more episodes of All Things Policy.
Thank you.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, Check us out at our Twitter handle at Takshashila INST or our website takshashila.org.in.
Remember the days when our granny used to narrate once upon a time stories? Let's bring back the good old days of moral stories with Storytime Tamil. Hi, I am Ravishankar Balachandran, host of Storytime Tamil podcast. I would like you to entertain and educate your children with stories from Storytime Tamil. Tune in to the new episode sharp at 7 p.m. every day on IVM website, IVM podcast app, YouTube channel, or wherever you get your podcast from.
Come learn and experience the ABCDs of being queer with me, Shunetro,
and me, Farhad,
on our show Gay BCD.
The two of us take you through our stories and experiences of being gay men in the city of Mumbai and have candid
and sometimes downright scandalous
conversations about sexuality, gay culture, and everything in between.
Catch new episodes of Gay BCD every Tuesday on the IVM Podcast website, app, or wherever you get all your podcasts from.